When you smoke a cigarette, nicotine reaches the brain 10 seconds after the smoke is inhaled. Your brain quickly gets the message that it wants more of the chemicals you're feeding it.
We wanted to get a better understanding of how smoking harms your body. So we went to Providence St. Joe's Hospital to talk with a professional about this issue.
Hi, I'm Shadi from
Hi,
Member of
Shadi.
Teens in Action.
I'm Dr. DeMonte.
Oh, nice to meet you.
Nice to meet you too. Why don't we go over this way and take a tour of the hospital?
All right, sounds good.
You are such a good actor.
So, what are some common myths with smoking?
Well, that if you smoke less cigarettes, it's safer. That if you don't inhale, it's safer. Or that if you use a lower nicotine or lower tar cigarette, that it's safer. But it isn't. It's still smoking.
It's been known that nicotine is just as addictive as cocaine and heroin. How does that work?
Well, addiction, there's two components. One is that it gives you a feeling that you desire, okay, which is, and smoking will give you a pleasant feeling initially. The second aspect of addiction is that it, if you don't have it, you will have withdrawal effects, also, which you will experience with smoking.
What are the physical effects of nicotine on the brain?
Well, nicotine, what it does is it releases a chemical which then affects the CNS, or the central nervous system, the brain, and that gives us the pleasant feeling. When that wears off, you get tired, you get depressed, and then the brain is actually actively seeking out the nicotine again, and that is the addiction.
So in a previous segment, we've talked about how the 8 ounces of tar collects in your lungs over a year when you smoke just 1 pack a day. So can you explain how the lungs do that, and how does it function that way to absorb that much tar?
Well, what happens is, tar is one of the things in smoke. When you smoke, it comes down into your lungs, into your bronchi. In the bronchi, there's something called cilia, which are these tiny microscopic hairs that beat upward to try to get whatever gets down into the lungs up and out. This tar, the smoke, all of the carcinogens in the smoke tend to slow down the beating of the cilia, meaning it doesn't allow the cilia to move properly, function properly, and what will happen is that it ends up getting stuck in there. Okay, so as a result of the tar being in there, you have more increased mucus production that isn't being expelled by your body, and so it makes you more susceptible to things like bacterial or viral infections.
More smokers get heart disease than lung cancer. So why is this fact not emphasized as much?
Well, the thing with heart disease is that there are a lot of causes for heart disease. Aneurysms, where you get bulging out of some of the major blood vessels, other things like emphysema, asthma, chronic bronchitis, high blood pressure, and possibly high cholesterol, possibly diabetes. It all leads up to this heart disease. That's why it's important to know that smoking definitely is a big risk factor for developing heart disease.
So in a sense, you're saying it's kind of like a domino effect leading to heart disease.
Oh yes, definitely. That's a good way to put it together.
So Dr. DeMonte, if you can explain to me, how does carbon monoxide affect the lungs and the body?
In essence, what happens is that the carbon monoxide sticks to the red blood cell. Even if there is carbon dioxide there, or oxygen there, it tends to have more affinity for the red blood cell, and the red blood cell then can't do its job and deliver oxygen to tissue in the body. In the cigarettes, there are low amounts of carbon monoxide, and that can result in tiredness, that can result in chest pain, We're all accustomed to the situation with, high levels of carbon monoxide where you sort of just lose consciousness.
Okay. You mentioned that not enough oxygen is delivered to the tissues. So what would happen to that living tissue?
Well, we are aerobic beings, and all our tissue needs oxygen. So if it's carbon monoxide instead of oxygen on that red blood cell, it's going to die.
Is the damage to your organs irreversible?
With smoking, yes, it can be. There's something called emphysema, or chronic obstructive pulmonary disease. Lungs are made up of alveoli, all these little grape-like structures inside. And if we were to spread out all the alveoli onto, a flat surface, it would be bigger than a tennis court. With emphysema, you have less surface area, so that tennis court size lung, pocket of space, is diminished drastically. And what happens basically is you have less lung capacity to be able to exchange oxygen, and you find that the person who has emphysema is almost gasping for breath. It's not fun to see.
Today, we are all concerned with our physical appearance. Can you just briefly explain to me how smoking affects it?
Well, primarily, I think one will notice that it ages a person by a lot in a very little amount of time. It gives you wrinkles, it yellows your teeth, it makes your hair and your clothes smell, and if you're active, it sort of decreases your athletic performance, and also makes you more risk for developing injuries and also healing less.
When you tell patients they have a serious disease related to smoking, what's their reaction usually like?
It varies. I mean, people who have had experiences with loved ones who have smoked may want to quit right away because they see the effects. But we both know that smoking is very addictive. So others may have a difficult time, even knowing that they have a disease, to quit smoking without the help of, some medication or therapy. They will have loss of wages. They won't be able to work because they either have to go to their treatments or physically they're not feeling well enough to go to work. Their families will suffer, and unfortunately it will lead to an earlier death.